অসম চৰকাৰৰ স্বাস্থ্য মন্ত্ৰী শ্ৰী কেশৱ মহন্ত ডাঙৰীয়া, শ্ৰী শ্ৰীকান্ত নাদুমুনি, founder chief technology officer Aadhaar and co-founder of eGov, Shri Binod Khosla, who is connecting with us from United States of America, Shri Nandan Nilakarni. আজিৰ সভাত উপস্থিত অসম চৰকাৰৰ স্বাস্থ্য বিভাগৰ প্ৰধান সচিব অবিনাশ যোশী ডাঙৰীয়া, আয়ুক্ত সচিব সিদ্ধাৰ্থ সিং ডাঙৰীয়া, NHMৰ মিছন ডাইৰেক্টৰ ডক্টৰ MS লক্ষ্মীপ্ৰিয়া ডাঙৰীয়ানী, ডাইৰেক্টৰ মেডিকেল এডুকেশ্যন ডক্টৰ অনুপ বৰ্মন, গুৱাহাটী চিকিৎসা মহাবিদ্যালয়ৰ অধ্যক্ষ ডক্টৰ অচ্যুত বৈশ্য ডাঙৰীয়া, Director State Cancer Institute Dr. Bivas Goswami Dangoria, Indian Oil Corporation or CGM Shri PK Bosumotari Dangoria, HDFC Banker Circle Head Premjit Kaur Dangoria, অসমৰ বিভিন্ন ঠাইৰ পৰা ভাৰ্চুৱেলি সংলগ্ন হৈ থকা আমাৰ চিকিৎসকসকল আৰু আজিৰ সভাত উপস্থিত সুধীবৃন্দ, ৰাজ্যৰ স্বাস্থ্য সেৱাৰ আধুনিকৰণ আৰু সবলীকৰণৰ দিশত আজিৰ দিনটো এক বিশেষ দিন। আজি আমাৰ সন্মুখত আমি এনে এটা সুন্দৰ প্ৰকল্প উদ্বোধন কৰাৰ সাক্ষী হ'ব পাৰিছোঁ, যিটো প্ৰকল্পৰ জৰিয়তে অসমৰ ICU কেয়াৰৰ যিটো পৰিৱেশ তাক এটা সম্পূৰ্ণ পৰিৱৰ্তন কৰিব পাৰে। কোভিডৰ পৰিৱেশৰ সময়ত আমি সকলোৱে ICUৰ প্ৰয়োজনীয়তা আৰু ICU মেনেজমেণ্টৰ ওপৰত আমি আলোচনা কৰিছিলোঁ আৰু ৰাজ্য চৰকাৰ আৰু কেন্দ্ৰীয় চৰকাৰৰ সহযোগত আমি সমগ্ৰ ৰাজ্যতে ICUৰ সংখ্যা যথেষ্ট বৃদ্ধি কৰিবলৈ সক্ষম হৈছিলোঁ। পৰৱৰ্তী সময়ত কেইবাজনো ব্যক্তি বা সংগঠনৰ সহযোগত ৰাজ্যৰ সৰু সৰু চহৰসমূহতো আমি ICU নিৰ্মাণ কৰিবলৈ সক্ষম হৈছিলোঁ। ৰঙিয়াৰ দৰে নগৰতো আমি 50খনতকৈ অধিক বিচনাৰ ICU আমি নিৰ্মাণ কৰিবলৈ সক্ষম হৈছিলোঁ। কোভিড পৰিৱেশৰ সময়ছোৱাত ভাৰত চৰকাৰৰ ডোনাৰ মন্ত্ৰালয় আৰু ৰাজ্য চৰকাৰৰ সহযোগত আমি এটা প্ৰজেক্ট আৰম্ভ কৰিছিলোঁ, আছাম ক্ৰিটিকেল কেয়াৰ ইনফ্ৰাষ্ট্ৰাকচাৰ প্ৰজেক্ট, যাৰ জৰিয়তে সেই সময়ত আমি NACIDS, NEC আৰু অসম চৰকাৰৰ আৰ্থিক সাহায্যত অসমৰ প্ৰতিখন চিকিৎসালয়তে ICU নিৰ্মাণ কৰাত সক্ষম হৈছিলোঁ। কিন্তু ICU নিৰ্মাণ হোৱাৰ পিছতে আমাৰ সন্মুখত এটা প্ৰশ্ন আহি পৰিছিল যে হাউ উইল ৰান দ্য ICU, কাৰণ পৰম্পৰাগতভাৱে আমি যেতিয়া ICU এটা নিৰ্মাণ কৰোঁ আৰু তাক পৰিচালনা কৰিব খোজোঁ, আমি এনাস্থেচিছ, ক্ৰিটিকেল কেয়াৰ নাৰ্ছ, এই সমগ্ৰ ব্যৱস্থাটোত এটা যথেষ্ট মানৱ সম্পদৰ প্ৰয়োজনীয়তা আমি অনুভৱ কৰি আহিছিলোঁ। আৰু তাৰ লগত ICUৰ যিটো ষ্টেণ্ডাৰ্ডাইজেশ্যন, ICU প্ৰট'কলছ আৰু ICUৰ লগত জড়িত ডিজিটেল ৰেকৰ্ডছ, এই গোটেইবিলাকৰ ক্ষেত্ৰত there was a huge gap. আৰু as a result, most of the ICU, in spite of having equipments, remain unutilized. আৰু even those who are being utilized, the result is not the way we wanted it to be. High mortality and high infection. Mortality because of infection, not because of the disease, is one of the remain a primary concern for all of us. Today is a landmark day because some of the unanswered question ji amar healthcare sector asil, through digital and technology platform, we are trying to provide answer to some of the unanswered questions. eGov, a NGO led by Shri Nandan Nilkarni and Srikan Nadamuni, is offering us some solution in collaboration with Corona Trust and HDFC and with a host of donor and resource person, that how we can run ICU in a hub and spoke model, how we can standardize, how we can put a strict protocol in place, and how medical records can be kept in completely transparent manner, and while doing so, the confidentiality of the medical records of the patient will be kept. So, এই যিটো project যে প্ৰতিখন জিলাত will activate 10 ICU, and all hospitals, district hospital will be divided into spoke, and they will be controlled from the hub in our medical colleges, is a very, very important landmark. আৰু মই এই প্ৰকল্পটোৰ বাবে eGov and Corona Trustক, মই e-Governance Foundation and Corona Trustক শলাগ লৈছোঁ. I'd like to give my deepest gratitude to e-Governance Foundation and Corona Trust, and of course the donor like Sri Binod Khosla, HDFC Banks, Google Crowd, and so on and so forth, because the list is long, and in India, the people who wants to do something good for the society is also, that list is also growing longer nowadays. So this is a very, very welcome development, আৰু মই সকলোকে ধন্যবাদ জনাইছোঁ. আজি what we are getting in the project, e-Governance Foundation and Corona Trust is providing state-of-art medical equipment. As we know that medical equipment provided by Hamilton is very good so far as critical care is concerned. So those kind of equipments will be there, not in GMCH, but in all our district hospital. That is very, very important landmark. Then second component of the project, nurses will be trained, doctors will be trained, even if they are not anesthetists, but they will be trained to handle critical care patient. Thereafter, they will be connected to a hub in medical colleges, so that 24 hours we can keep on providing support. Dr. Priyam has demonstrated us the technology that even if the doctor is in home, from there also he can provide support to the patients. Finally, standardization in terms of equipment management and in terms of treatment protocol, and finally a very good dashboard. I feel that this dashboard will be connected to our CM dashboard also, and we can keep on monitoring the situation on daily basis. মই ভাবো যে our health department will join this initiative with equal enthusiasm, and there will be continuous strengthening of both hub and spoke in terms of deployment of medical resources, human resources, good maintenance, and maintenance of good standard. In a country like India, where geography is so large, medical care by doctors in every villages or every helmets will not be easily possible. Although we will not surrender, we will keep on adding medical colleges, we will keep on adding teaching facilities, so that we can ultimately achieve our goal of providing medical personnel at the doorstep. But still, during the interim, technology is only the answer. Through technology and with the innovation of or application of 5G in India, I think medical care through technology has become very, very affordable and also easy. Just now when we have seen that the vitals of a patient who are in Mongoldoy, who is at present in Mongoldoy Civil Hospital, can be monitored in Guwahati Medical College, and from this auditorium we can see the vitals as if we have seen the vitals in our front. So that kind of technology with 5G has come to in our country, and I am sure that the medical fraternity will take full advantage of the technology which are in our possession today. We are also discussing about AI, ChatGPT kind of thing. Of course, I don't know how much answer will be there instantly, but this needs to be improved further, because sometimes when I also put question on GPT, sometimes answer doesn't come the way I wanted, and there is a lot of still gap between the AI and actual platforms. Of course, I am not a doctor, but on our field, when I try to seek some answer, then sometimes answer doesn't come the way I wanted or what is fact. I think that is a on evaluation, but I'll advise medical fraternity not to use GPT kind of things immediately until and unless it is completely verified, because to treat a patient with the help of GPT, you need some kind of legal sanction, because it may lend up to problems. But this is evolution stage, and I think within 1 year we'll reach that stage. There is no doubt, because technology is running faster than what we can even think of. Mur monot ase Yudhishthirok jetia Dharmarajai সুধিছিলে question, tat সুধিছিল je আটাইতকৈ স্পীডত কোন যাব পাৰে, তেতিয়া answer was that mon আটাইতকৈ বেগী. But I think now technology has বহুত তাতকৈ বেছি স্পীডত গুচি গৈছে. So that's the change we have seen over a time period. So thank you very much, Srikanji, and hope this partnership will continue. And on health sector, we are immensely committed. We are spending more than 6% of our GDP in health sector, and every year it is increasing. There is no doubt on that. And we are also on public-private partnership. We are doing really very good in terms of cancer care and many other initiatives. So I have some idea also that how we can address some more critical gaps in healthcare through digitization and technology. Definitely will carry forward that discussion. আজি এই অনুষ্ঠানৰ লগতে গুৱাহাটী চিকিৎসা মহাবিদ্যালয়ৰ বাবেও ন্যাশনাল ইমাৰ্জেন্সি লাইফ সাপোৰ্ট স্কিল সেন্টাৰ, মাল্টিডিসিপ্লিনাৰী ৰিসাৰ্চ ইউনিট, ইণ্ডিয়ান অইল কৰ্পোৰেশ্যনৰ সহযোগত 32 স্লাইচ সিটি স্ক্যান তেখেতসকলে আমাক বৰঙনি হিচাপে আগবঢ়াইছে। মোৰ ইণ্ডিয়ান অইল কৰ্পোৰেশ্যনলৈ বহুত বহুত ধন্যবাদ। আৰু আমাৰ মলিকুলাৰ অংকলজিৰ ওপৰতো আজি আমি ইয়াতে খুব ষ্টেট অফ আৰ্ট লেবৰেটৰী এটা উদ্বোধন কৰিছোঁ। মই ভাবোঁ যে প্ৰিভেনশ্যন এণ্ড কণ্ট্ৰল অফ কেঞ্চাৰৰ ওপৰত আমাৰ যিমানখিনি প্ৰচেষ্টা, তাত আজিৰ এই মলিকুলাৰ লেবে যথেষ্ট আমাক সহায় কৰিব। আমাৰ ৰাজ্যৰ মেডিকেল সেক্টৰত সঘনাই সন্মুখীন হোৱা আমাৰ এটা ডাঙৰ প্ৰব্লেম হৈছে যে ইকুইপমেণ্টছ মেইনটেনেন্স। আমাৰ obviously in our medical college we cannot provide 2 MRI or 2 CT scan, 3 CT scan. So asset maintenance is a very very big challenge for us. মই ভাবোঁ যে আটাইতকৈ আমাৰ আজিৰ দিনত সমস্যা যে এখন মেডিকেল কলেজত যেতিয়া মেচিন বেয়া হৈ যায় আৰু তাক অন টাইম যেতিয়া আমি ৰিপেয়াৰ কৰিব নোৱাৰো পেচেণ্টৰ বহুত বেছি অসুবিধা হয় we are constantly trying to address the issues that how in Assam we can put a very good maintenance team je amar jate machine beya nohoy till the lifespan that is why we introduce CMC that all our equipment will be backed by comprehensive management but there are many equipment where in spite of the agreement the engineers come at a very late and a lot of patient has to face the kind of agony. So today we are starting a asset management portal. At least now we will know that how many equipments are not in order. When we have asked the company to repair, how much time they are taking. And all this can be considered when we are trying to award a fresh order to the company because maintenance is the key. The company who is not good in maintaining the equipment, I think they do not deserve fresh order. So this asset management portal will be a great help towards our maintenance of assets properly. মই পুনৰ এবাৰ স্বাস্থ্য বিভাগক আজিৰ এই সুন্দৰ অনুষ্ঠানৰ বাবে ধন্যবাদ জনাইছোঁ আৰু মই আশা কৰোঁ যে আমাৰ স্বাস্থ্য বিভাগৰ যিটো উত্তৰণ সেই উত্তৰণ অব্যাহত থাকিব বিশেষকৈ ক্ৰিটিকেল কেয়াৰত আমি কন্ট্ৰিবিউট কৰিব পৰাটো আমাৰ কাৰণে এটা বহুত ডাঙৰ সৌভাগ্য মই নাজানো why but in spite of our best effort in last 2 years road accident case ami komabo pora nai every day is number is increasing we have we tried to rectify road we introduce many best practices we force people to have helmets everything whatever in our command we have done but still we are not able to so far we have not able to reduce road traffic accident cases to the desired level and we can save life only when critical care is in place otherwise we cannot save lives so moi bhabu this is very important for us aru aji ami jitu kam korisu tar folafol definitely ami pam and I feel happy that our hospital like Hailakandi, Karimganj, they have become very, very proactive. Our health sector at a gaps asile, the certain district we could not offer the health care to the desired level, primarily because of geographical remoteness and also due to motivational factor. So if in our state, Haflong, Karimganj, Hailakandi hospital gets award for motivation, then this is a very, very important landmark. So, moi atai kekhon চিকিৎসালয়কো ধন্যবাদ জনাই পুনৰ এবাৰ আপোনালোক সকলোকে ধন্যবাদ জনাই মই মোৰ বক্তব্যৰ সামৰণি মাৰিছোঁ ধন্যবাদ